Well, let's talk COVID, obviously. We've got the booster rollout moving apace right now. There was an event yesterday. The Prime Minister was talking about getting needles in arms like a sewing machine going up and down. We're looking at over 18s being eligible for their boosters. Is that from today? And will we see perfectly healthy young 18-year-olds being competing with, 70-year-olds who haven't got their boosters yet in the same queue? And is that a good idea?
No, we won't be doing that because it probably isn't a good idea. But we're working on the operational elements. Obviously, we got the advice from the JCVI yesterday. We said we were going to act on it straight away. We'll operationalise the plan. There's actually a press conference that will lay out more details a bit later on. But I would imagine that we will come forward in age cohorts and go down the age cohorts. I mean, we've already done 17 million of our most vulnerable and elderly people. But I would imagine we'll go down and continue to call people forward in their age cohorts.
And in terms of rolling out the jabs, the second jabs for 12 to 15-year-olds, there hasn't actually been that high a take-up of 12 to 15-year-old first jabs. I mean, I'm among those parents who's, my daughter has had 2 doses of COVID. I'm not entirely sure that it's wise to go against the advice of the JCVI initially on having even the first jab, given that she's already got that protection. But since whatever new evidence do we have for the second jab to be rolled out to that age group? Has there been new evidence and new data that has changed that decision?
Well, what they look is they look at the balance of risks and they look at the, the advantage versus the balance of risks. And that's what they're doing all the time. And basically what they've said is, OK, we don't know an awful lot about this new variant yet, but we know it could be highly transmissible. We know what happens with highly transmissible viruses. It goes for the unvaccinated or those that have lower protection. So we're just trying to make sure we get as many people as much protection as possible, just to build that wall of defence.
Except the vast majority of that age cohort have already had COVID in recent months.
Yes, but, again, that's another thing we don't know about this new variant, how the antibodies, that you've built up naturally, how effective they will be. So what we're trying to do, obviously we're buying time by delaying things and, trying to put back in place some of the measures that we had. But that's to delay, to buy some time for our scientists to then give us that advice. And as much as we can do right now, because, of course, there are concerns about how high the transmissibility could be. So that's why we're basically saying let's build that wall of defence even higher.
Well, I mean, Joe Biden, the American president, he said there's no cause for panic. The people who actually discovered the new variant in South Africa said there's no cause for panic. World Health Organization is saying it's a variant of concern, but not a cause for panic. So we're buying time. To learn whether or not this is going to be... There does seem to be quite a lot of evidence that it is more transmissible, this new variant, but finding whether or not the vaccines are still effective and learning whether or not it causes more severe disease. The evidence so far to date suggests it doesn't cause more severe disease in South Africa, but as you say, we don't know yet. When we've bought that time and we've had all that research done, and then we've got an answer, will we then get rid of all the new restrictions on our lives?
Well, those new restrictions have 3 weeks, so we'll be reviewing them again in 3 weeks. So there's a debate actually in Parliament on them, a vote, and then there'll be a 3-week review time. Because we're very conscious of the fact that, of course, if we're trying to be balanced and proportionate, but of course, if it turns out that we don't need to do these things, then of course we've got that 3-week review period, which
okay. But you say 3 weeks, but that review actually is in 3 weeks' time from when that was announced is the 20th of December. Parliament breaks up on the 17th of December. At that point, there are concerns. Mark Harper, Conservative leader of the COVID recovery group, has pointed out we could have a situation if MPs are not voting on those restrictions going ahead again, then we're looking at basically government by decree once again. And yet we're not in an emergency situation. How can you justify that?
Well, first of all, we need to figure out the advice will start to, the scientists will start to inform us as they find out more. It could be, as you said at the beginning, that, the vaccines work well and there's not much to worry about, in which case they'll expire. It could be that we find out more, in which case we'll obviously inform people along the way. Okay. We really do have to act on the scientific advice, and also obviously they'll be talking through the Parliament, and the leader of the House will be talking through what measures need to be put in place if we do need to extend the restrictions.
Okay, well, I mean, I would argue never need to extend restrictions. It should always be a matter for people to be given advice, strong advice sometimes, but it should always be up to people about their own trade trade-off on safety and liberty. Let's talk about some of the new rules, though. And again, I'd like to point out that actually the rules on self-isolation, if you come into contact with Omicron or coming back from a foreign holiday, these don't fall in 3 weeks. They actually continue till the end of March. So that is something that people may well be stuck with.
Yes, and obviously we need to find out more about this variant. We want to try and delay the spread. We want to try and manage it as best we can. The transmissibility of the variant is something that looks as though it's highly transmittable. What impact it has on the vaccines is what we don't know.
Let's talk about masks. So masks are going to be legally required in shops today. They're going to be legally required on public transport, in hairdressers, beauty salons, estate agents, takeaways, cars, so private hire vehicles, taxis, and the like. Not in restaurants and bars, not in the workplace, and interestingly, not on a bus that's used as a party bus. There is actually a limitation on this in the actual legislation that says where a person is in an area within a public transport vehicle which is being used wholly or mainly by people eating or drinking or dancing, then the rules don't apply. This is just a nonsense, isn't it?
Well, obviously, we've tried to get the balance between, when you're going into a crowded place, wearing a mask, etc. But actually, if you're there for eating and drinking, then the mask's on and off all the time anyway. So that's what we've tried to get the balance between. And of course, we expect people to be sensible. There's a lot more people wearing a mask as we've come into winter anyway.
Well, then why do you need to mandate it then? The people who want to wear a mask can wear one.
Because we're trying to be balanced and proportionate. We're trying to put these extra measures in place. We're trying to give the scientists a bit more time. We're trying to delay, the spread of a very new variant that we know is here. We just learned about 3 more cases in Scotland. We're trying to make sure that we give the scientists some time, and then we'll know what we're dealing with.
But if so many in the cabinet are so concerned about this, they want to restrict our freedoms once again, because they're so concerned. Why was the Prime Minister and half the cabinet at a lunch yesterday? I'm not saying anyone should be required to wear a mask, but they were in a very crowded environment. Lots of older people, certainly more at risk than secondary school pupils who've all had COVID and at very low risk anyway. Not a single one of them was wearing a mask. No one was wearing a mask, apart from the waiting staff, of course, which is often the case. If they're so concerned about this new variant and really, really worried and feel they need to bring in restrictions on other people's lives, why do they not want to wear masks themselves?
Well, it gets back to what we were talking about earlier. At lunch you're eating. Obviously, the waiters aren't eating, but you're eating.
People were mixing. They were standing. People were barely at their tables. They were standing, chatting.
Well, they're eating and drinking, and that's exactly what happens in a bar, right? So we've made the distinction for now between going to a place eating and drinking and going into a place and basically buying something or having something done, and that's effectively what we've done. So and as I say, we've brought this in for 3 weeks. We think it's balanced and proportionate, just to be able to buy some time to give our scientists the time to give us more information.
Just finally, what the big worry is? Are we going to still get Christmas this year after it was cancelled last year? Half the country was in tier 4. There's travel restrictions. It was absolutely devastating for people after a really, really tough year. We had another tough year this year. People want life back to normal. Do you honestly believe that if we did have restrictions over Christmas, perhaps limiting households, perhaps other rules or traffic restrictions, do you think people would obey them?
Well, first of all, we're in a much better place, right? We've got the vaccines, we've got the boosters, we've got the treatments. So I think that's the first thing. And we obviously, the thing we want for Christmas more than anything is for people to come forward and get vaccinated. If they haven't come forward for their first dose, come forward. A second dose, come forward. Booster, we'll be in touch. The plans will be being laid out, but please come forward. Really, all we want for Christmas is everybody to be jabbed and boosted where eligible.
All right, Gillian Keegan, care and mental health